in case there is a reduction in kidney function by biochemistry, or the patient shows signs of kidney stones such as pain or blood in the urine, the patient should be referred to a CT scan of the kidneys. There are no guidelines. They have specific. They're very specific on how often asymptomatic patients should have imaging of the kidneys performed, or whether it should be ultrasound and CT. It's therefore quite difficult to give a precise answer to the question. But we know that in order to detect calcification stones in an early stage, it should probably be performed every 1 to 2 years. The thing is, we need to take into consideration the radiation to the patient, the age, and so far when we refer them for investigation. But especially in the patients with just small symptoms, it's important to have an ultrasound, a CT scan performed. In regard to CT scans of the brain, then we know that patients with long-term hypoparathyroidism, and especially patients with pseudo-hypopara, and to some extent patients with non-surgical hypoparathyroidism, have an increased risk of calcification, especially in the basal ganglia. There have been done a few studies on the subject, but there's not really been a convincing association between the calcification and the cognitive symptoms. Neither do we actually have any treatment option for the calcification in case that we find them on a CT scan. So there's probably no need for routine CT scans in these patients. But if they do experience cerebral complications, it could be performed. It is important to notice that the MRI scans does not show calcification as well as CT, so you need to sign in for a CT scan. In regard to the bones, then there is no need for routine DEXA scans. Patients with hypoparathyroidism is known to have high bone density. But one thing we need to bear in mind is that some of these patients had hypoparathyroidism late in age and due to surgery. And these patients might have had a risk for osteoporosis. They might have had hypothyroidism or primary hypoparathyroidism as a cause for their surgery. So in these patients, then BMD measurement should be considered just as in standard guidelines and as other patients. But there have been some studies on fracture risk, and for now there has not been found any increased fracture risk in patients with hypoparathyroidism.